of late. Surprise medical bills, modern healthcare, physician hospital groups gear up to fight on surprise medical bills. And you're supporting a bill that Protecting People from Surprise Medical Bills Act, a bill that would ban the practice of billing patients for unanticipated out-of-network care. It would implement arbitration model that identifies reasonable payment rate when insurers and providers cannot agree on the cost of care, and require health plans to clearly identify in-network providers and patients' deductibles. Certainly at the hearings, it sounded like almost everybody was on board for. What sort of pushback are you getting on this?
Yeah, the key here is we need to take the patient out of this equation, right? For example, if you go to the hospital to have surgery and your hospital and your surgeon are in network, but months later you get a bill from the pathologist, and turns out the pathologists at that hospital were not in your network and they're out of network care, then your insurance company won't pay. And so what we need to do is find a way to make sure that the patient isn't responsible for that bill. And so there's a couple of ways to do that. And some people have suggested that we just set a kind of a baseline rate and that would be paid. Without any arbitration or what I would call independent dispute resolution process. And so what the state of New York has done is they have created an arbitration process where the physician provider or the provider in general and the insurance company can come to a decision about what they think is a fair rate to pay, taking the patient out of it. If you just set a rate, if the federal government mandates that a private sector insurance company pays a certain rate, then that's price fixing. And the providers will end up being paid less and less over time, because then the networks, which is the in-network payments, will start to drop because there will be no reason for insurance companies to keep doctors in network because their out-of-network payment is going to be much less.
As a physician, as a surgeon, was it ever hard to make that call to treat or not treat in the back of your head, thinking, how's this patient going to pay for it?
No, it has nothing to do with the way you take care of patients. Yeah. I never did look at what type of insurance patients have. That's up to the office, the business people. And so as a physician, that honestly, I can say for myself, I can speak for myself and probably 99.9% of physicians, whether or not people have health care coverage when you're treating them for emergency conditions, for example, doesn't come into play at all, because that's our job, right? That's what we signed up to do. And that's what we want to do. We want to help people.
And in terms of your legislation you're proposing, think it'll get debate and pass? Or?
I think right now there's a large debate both in the House and the Senate and at the White House about what the proper approach is. I'm hopeful that we will come to a resolution of this that does include an independent dispute resolution process so that it can be fair for both the provider and the insurance plan. But the main key is here, remember what I said right at the beginning, is that patients should not get unexpected medical bills unbeknownst to them because a provider was not